DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Hi there, folks. Welcome to DocTalk. Dr. Dan Thomson here from the College of Veterinary Medicine. We're going to have a great show today. We're going to talk about anaplasmosis in cows with Dr. Gregg Hanzlicek from the Veterinary Diagnostic Lab. Thanks for tuning in today, and we'll see you here in a second.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thomson here with Dr. Gregg Hanzlicek. Thanks for being here.
My pleasure, Dr. Thompson.
Always good to have you. Dr. Hanzlicek is the Director of Production Animal Field Investigations here at the Veterinary Diagnostic Lab at Kansas State University. We're going to talk about something that's increasing, at least it seems like to me, in awareness and clinical cases in our cow herds, and that's anaplasmosis.
That's exactly right. We used to think of it as a southeastern and upper northern western part of the United States problem, but it is a huge issue in the Midwest, particularly in southeast Kansas and western Missouri.
Yeah, it's one of those things, when I went through veterinary school, we learned it as kind of a tropical disease, and now, here we go. We start seeing clinical cases of it out here in our cow herd. So what is anaplasmosis?
Well, it's a bacteria, and it's a bacteria that specifically attacks the red blood cells of the cattle.
So if we attack the red blood cells of the cattle,
then the spleen recognizes the red blood cells as being foreign, and so the spleen removes the red blood cells from the animal. The animal becomes anemic. It basically has no oxygen carrying capability, and that's where you start seeing the clinical signs.
So we get this bacteria into our cow. We knock out the red cells, and the red cells are really important in carrying oxygen from the lungs to the rest of the body.
That's exactly right.
Well, we talked a little bit about the geographical location. What are some of the things, can it be subclinical? Meaning that we don't see the clinical signs?
It can be, and that's specifically in animals that have gone through the infection and recovered.
Okay.
They will be carriers for the rest of their life, and they will be subclinical. You will not see those animals ever have the clinical signs again.
And the importance of this then, beyond we'll get into some of the clinical signs and the clinical manifestation, but what are some of the things that, do we see production losses and things to that nature when we get into this with cow herds?
We can. The literature talks about fever and loss of milk production, those kind of things. But we typically don't see that. What we start seeing are just sick adult cows. And that's the neat thing, or maybe not the neat thing about the disease, is that the younger animals less than a year of age, they do not show clinical signs even if they're infected. It is as the older animals are the ones that are going to show the clinical signs.
And any reasoning for that? Or
the older animals, those older cows, they're able to regenerate those red blood cells is less than a calf that's under age of 1 year of age.
So it gets back to kind of like when you have young people versus older people, and the healing capacity and the ability to stay healthy just recover so much quicker.
That's exactly what it is. Yeah, it's a pretty cool disease.
It is. Well, I appreciate you being here today. We're going to discuss more about anaplasmosis, get into some of the clinical signs, treatments, and prevention, and we'll come back after the break. We sure appreciate you watching DocTalk, and we'll see you here in a minute.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Blaine Johnson grew up on a cow-calf and feedlot operation in Red Oak, Iowa. His undergraduate work was in animal and dairy science, receiving a Master's of Science in Animal Science with a focus in ruminant nutrition. Blaine is currently a fourth-year veterinary student at Iowa State University College of Veterinary Medicine and will graduate in May 2016.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from MERCK Animal Health.
Hey folks, Dr. Dan here, and I want you to join us in Kearney, Nebraska on May 11th for a stockmanship clinic. We're going to talk about how to work cattle in teams, we're going to talk about cattle handling techniques, and much more. Experts from across the country are going to be there. Dr. Tom Knopfsinger, Kurt Pate, Ted Howard, Kip Luga-Savage, myself, many more are going to be there to work with you on this clinic. Go to packdvms.com to get the agenda and to register.
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the vet gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Hi there and welcome back to DocTalk. Dr. Dan Thomson here with Dr. Gregg Hanzlicek, who's a veterinarian, and he is the Director of Production Animal Field Investigations for the Veterinary Diagnostic Laboratory here at Kansas State University's College of Veterinary Medicine. And Greg, we're talking about anaplasmosis in cows. And we kind of left at the end talking about the difference in younger and older animals or older cows and clinical disease. But let's just kind of march through the yearling stock and younger, and then the 2 to 3 year olds, and then the older cows.
Okay.
What we're going to see if we think we have anaplasmosis.
Okay, and because this is a bacteria and it's in red blood cells, anything that moves red blood cells from an infected animal to a non-infected animal is the way it's going to be transferred. So we're talking mosquitoes, stable flies, needles, tattoo pliers, those kind of things. So what I'm saying is once you get it in the herd, then the whole herd has the anaplasmosis, but the younger calves, they just act normal.
Okay, so they could have the disease or have the bacteria on board, and because their ability to regenerate these red cells, they aren't going to show clinical signs.
That's right. And then the animals, say under 2 years of age, they'll show some of the clinical signs such as constipation, maybe abortion, talked about the low production, those kind of things, but they typically do not die. It's the older cows. They show the clinical signs, and if you move them or stress them because their body is so starved for oxygen, a good percentage of those animals have a tendency to die.
Gotcha. So when we're looking for if you're going through I got a cow in the chute, which we hope to get them to the chute.
Right.
With anaplasmosis. But if I have a cow up close, what are some of the things I'm looking that animal over and kind of looking at the, gums, eyes, different things to that nature?
That's an excellent question. Early on, they'll have pale. The white membranes around the eyes and around the vulva will be pale. A lot of times they'll be open mouth breathing. They'll act like they have pneumonia because their body's saying we need more oxygen, we need more oxygen. If you're walking them slowly, they'll be stumbling. They'll be falling down like they've been through the bar too long.
Yep.
And then later on, their tissues will start to turn yellow.
So they get that jaundice.
That's exactly what it is.
And that's from the breakdown of those red cells and that coming out into the fat and different areas of the body. So younger animals, not a problem. 2 to 3 years old, we're going to start to see a little bit of the clinical signs, and then we get to those older animals. One of the things we talked about during the break that I thought was pretty interesting is how you can have a cow that's, docile and friendly, but as you were explaining earlier, they start to get starved of oxygen, they're maybe not so friendly. That's
exactly right, and that's what we tell producers. If you have anaplasmosis in your herd, one of the biggest dangers are those animals absolutely become aggressive because their brain's starved for oxygen, they're not thinking right, they're not performing right, but they will take you, your horse, the pickup.
Yeah.
So, very dangerous.
Yeah. Well, it's, very interesting bacterial infection, very interesting disease. And when we come back, we'll start to jump into what we're going to do to treat it, and then more importantly, how we're going to prevent it. Sure appreciate you being here. Appreciate you all watching Doc Talk today. When we come back, more with Dr. Gregg Hanzlicek talking about anaplasmosis. We're sure glad you joined us.
The BQA Tip of the Day, sponsored by Behringer Engelheim Vetmedica, Inc.
This is Shane Terrell with Production Animal Consultation, here with today's BQA Tip of the Day. Today we're going to talk about proper organization or good organization of the work area, primarily for employee safety or the safety of those people working in this area, and for efficiency of processing. The first example is, and as you can see, this yard is using multiple clips, magnetic clips and hooks, so we can organize products in a manner in which they can be used systematically, so they're administered to the proper area, and we're applying those products with proper spacing. Other examples would be hanging cords or dropped cords that allows for less opportunities for processors to trip. Other examples would be having tags laid out in an orderly manner to speed up the efficiency of processing. Any record keeping that needs to be done, having a space available so that can be done in an efficient manner.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
Hey there folks, I'm Dr. Dan from DocTalk. On behalf of myself and the staff at Drovers, I'd like to invite you to our Cow-Calf Cowboy College in West Des Moines, Iowa on June 20th and 21st. We're going to have speakers such as Mike Apley, Tom Knopfsinger, Chris Reinhardt, and Mr. Dave Nichols from Nichols Angus Farm. For registration, please visit droverscowboycollege.com or call us at 1-877-482-7203. I hope to see you all there.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease. With the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thomson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by the Director of Production Animal Field Investigations for our Veterinary Diagnostic Lab here at K-State, Dr. Gregg Hanzlicek. And Greg, we're talking about anaplasmosis in cows, and we've talked about what it is, what the cows are going to look like, and now we need to treat them. So let's start out with gathering them. What are some of the things, pitfalls, things that producers need to think about when they're handling these oxygen-deprived cows?
Wild cowboys equals dead cows.
Yeah, gotcha.
So, dogs, moving those animals fast will kill off a certain percentage of the old cows. So walking them very, very slowly to the chute is the best thing to do.
Got to take your time. Got to let the animal catch its breath, stay oxygenated, get it to the chute. Okay, when we get it to the chute, of course, we want to make sure that our producers are working with their local veterinarian. We always recommend to work with our alumni and beyond, and that. But what are some of the different philosophies in treatment of these cows? Are they treatable?
They are treatable, and the basic tetracyclines, so LA200, biomycin, those tetracyclines at labeled dosage will reduce the number of parasites in the red blood cells. So the treatment's it's pretty rapid, and it's a pretty good treatment for reducing the clinical signs in these animals.
So is there any we have feed grade tetracyclines? Is that something that's enough for treatment, or is that something? I mean, you don't know if you get it in the animal,
right?
But
well. And as you know, feed-grade antibiotics, you can't go off-label. So
right.
You can't feed it for another reason. You can't feed them more. You can't feed them less. And to my knowledge, the labeled antibiotics per feed say for the control of anaplasmosis. So it's
not for the treatment.
It's not for the treatment. It's for the control, whatever that means. So if you have a herd that has clinical anaplasmosis, you're better off going with the injectable type.
Get them in, and sometimes treat everybody or treat a portion of them, or just treat the ones showing the clinical signs? I
would use your veterinarian's recommendation on that, because everybody has their own experience and their own recommendations, and I would just use your local veterinarian for that.
Can't go wrong. Can't go wrong there. Well, let's jump into some of the prevention then. I know we're gonna go to break here after a bit, but let's go ahead and start in with some of the prevention. Is there a vaccine for anaplasmosis?
There is a vaccine. In the United States, there's one vaccine. It's a killed product. It's on a provisional license from the USDA, meaning USDA says you haven't gone through all the hoops to prove that it works, but we recognize there's a need. It's approved state by state. So if a producer wants to use it, they get a hold of their practitioner. He calls the state veterinarian. The state veterinarian says, yes, you can use it, or no, you can't.
Okay. Well, I think that's a good place to pause for a break. And when we come back, we'll follow up on prevention and some of the things, biosecurity and different things that producers need to know as we're moving forward. Appreciate you being here. Appreciate what you do for Kansas State University. And we'll come back to you guys in a minute. Thanks for watching DocTalk this morning, and we'll see you here after the break.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
I'm Joe Mushrush with Mushrush Red Angus, and my ancestors have been in this part of the world. Well, they walked in after the Civil War from Virginia. My dad was the start of Mushrush Red Angus. When we come back from college, we had about 100 cows, was working mainly part-time. My wife Connie and I, once we took over, tried to expand rapidly, making it into a full-time operation. We have told our kids that any of them that wish to return to the ranch, why we would do our level best to make a spot for them. And so far, our oldest son, Daniel, is now back full-time with us, and some of the others have expressed a desire to return, and so we have dedicated most of what we do into creating a spot and making a viable entity for anybody that wants to come back.
In an effort to get more of our family back on the business, we've started our own meat company. And so when we can take, say, a flat iron or a petite tender, and our local packing house has the knowledge and the ability to turn that into a higher retail cut, we'll sell those retail cuts quicker, and we'll sell them for 3 to 4 times the price of what we would sell them without some of those cuts being available to us.
The beef checkoff allows us to do something that we can't do on our own. We do not have the time or resources or the knowledge to go out and approach consumers on our own. By pooling our resources with other producers, it allows us to reach those consumers that we otherwise would not have any way to reach. And by combining our resources and our voice, why, hopefully we can make a difference.
And I hope one day that my children will be here on the ranch. So we need to be able to be responsive to the demands of future generations that we may not even be aware of, and the checkoff helps our industry do that.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Gregg Hanzlicek. And Dr. Hanzlicek is the Director of Production Animal Field Investigations here at Kansas State University's Veterinary Diagnostic Lab. And we've been having a discussion on anaplasmosis in beef cattle. Talked about what it is. It's a bacteria that affects the red blood cells, which decreases oxygen carrying capacity of these critters. And we've talked about the clinical signs and what we look for and how we're going to treat it, but really prevention's the key. And some of the things that we talked about, we've already talked about the vaccine. Now let's talk about other methods of control.
And so it's biosecurity.
Biosecurity and of blood, right?
Yes, and first of all, do not bring animals in from the outside if you do not know what their anaplasmosis status is, because you're going to be doing things to those animals that transfer blood, unless you're changing needles between each animal and those kind of things. So keeping it out of the herd in the first place is probably the best step.
Yep. So if you don't have it and you bring an animal that does in, we're going to have problems with your animals at the house. And vice versa, if you bring in animals that haven't been exposed to it and you have it in your herd, there could be some issues. So the prevention of blood from an infected animal to the blood of a non-infected animal is the key.
That's exactly right.
So what are some of the things we think about there?
Well, fly control.
You bet.
The best we can, and it's stable flies and horse flies, which our fly control isn't really that great for those insects, but still fly control is important. At least disinfecting or changing needles between animals if you have it. That way you're not transferring it. If you're using tattoo pliers, disinfect the pliers between calves. Those kind, anything to keep the blood from contaminating.
And what it's doing is to some of us is things that people that when you know back in the 80s and things like that, the people that lived in the Florida and South Texas and Western U.S. region, they were having to do all the time, changing needles. You know, we'd always hear the stories about anaplasmosis in those climates, and so you know it's something that may be new to us, but it's not new to a lot of folks.
That's exactly right.
But disinfect your equipment, castration knives, Newbery knife,
anything that gets bloody needs to be disinfected.
Any kind of disinfectant that's better one than the other? Or?
Not really. Just get the blood off. Even pure water is okay. Just get the blood off before you go to the next animal.
And it's important to note that this isn't a zoonotic disease.
It is not.
Okay, so it's not something that that contact with the blood of cattle from anaplasmosis, a human being won't get that.
Not this anaplasmosis organism. You're exactly right. It is not transmitted.
There is a human, but human to human, not animals to humans.
That's exactly right.
Well, we sure appreciate you being on the show today. It's always a pleasure to have you. Always good information, and hope to have you back soon.
My pleasure.
If you want to know more about what we do on DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thomson, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by MERCK Animal Health, the science of healthier animals.